From the Zoomerplex in historic Liberty Village, theZoomer, hosted by Libby Znaimer.
Welcome to theZoomer. I'm Libby Znaimer. Pain, whether it's from injuries or illness, general achiness, or simply aging, we all experience pain in our lives. For those who don't know, I have had 3 different kinds of cancer, and I recently had major abdominal surgery. I've had many operations, but for the first time, I was given an epidural for the pain. Research shows that this type of drug has favorable effects, not just on pain, but on the recovery as a whole. I had virtually no pain in the hospital and was able to go home on day 6, which is almost unheard of. The worst pain I experienced was with a procedure that should have been very simple, removing a surgical drain. So, yes, what works and doesn't work is very individual and often unpredictable. So, first, to get into it, what's the difference between chronic and acute pain? Dr. Moayedi.
Hi. So acute pain is any sort of pain that lasts less than 3 months. Chronic pain, which has recently become a disease in and of itself in the classification, is any pain that lasts more than 3 or 6 months, or the normal time it takes for a tissue to heal. About 1 in 5 Canadians suffer from chronic pain. In fact, there's a recent report from the federal government called the Canadian Action Plan for Pain that did a whole national survey of pain. And it is becoming a bigger concern as people age, because pain and aging is a real problem.
Do we have any idea why?
Well, there are so many factors that may be affecting a person as they grow through the ages and as they become elder. It can be degenerative changes, it can be problems related to the nerves, and it can be a lot of psychological issues that would affect them through the stress of life. This is a psychosocial model that we have to take on to understand and even treat the pain.
Dr. Luo, what is the role of mental health and pain?
So, well, as a psychologist, I see a lot of people in my practice. They came to see me because they have pain. And one of the most important things that they didn't realize that they can see a psychologist because they have pain. And after people have pain issues, they experience a lot of anxiety, depression, isolation, anger, that all become very cynical as well, right? So they have a lot of that kind of mental health challenges. So that's what psychology can do a lot to help them better cope with pain, to live a more fulfilling life.
So if you are able to minimize their anxiety and the other things, does it help with the pain?
Yes, it does. That's the very interesting part about, especially with chronic pains, that when people's mental health becomes improved, their pain experience can be improved as well.
Haley, you're a palliative care physician, and a lot of people think it's just for the end of life, but actually it's for dealing with symptoms like pain.
Absolutely. Palliative care is care for people with severe illness. We use a multidisciplinary team of not just doctors, but nurses, pharmacists, social workers, and we really are an added layer of support to other people's medical teams and doctors to help improve symptoms, improve quality of life for both patients and their families. It can be offered at any stage of a severe illness, and oftentimes even when curative treatment is still being pursued, like chemotherapy or surgery or a transplant.
And I'm sure that you get a lot of people coming in for pain, and the first thing is something over the counter, right?
Of course, and there are a lot of over-the-counter options that we can definitely present to our patients. However, it is important for patients to consult with a pharmacist before self-selecting any items, because there are a lot of considerations that had to be taken before picking a medication. Just because it's over the counter doesn't necessarily mean that it's going to be safe from you. So we do have to take things into consideration, like your current medical conditions, your current medications. When we do that assessment and we recommend a product, we want to make sure that it's the best possible product for you, and that it's also going to be safe for you at the same time.
Is there a problem with people just picking the wrong thing for themselves?
A lot of times, patients may, Google things. They may, find something online that they want to pick out, and they may not consult a pharmacist. Then we may, hear back from them and say, they're experiencing a side effect, and that side effect could have been prevented in the first place. By consulting a doctor or by consulting a pharmacist, we want to work collaboratively with the patients, with the prescribers to make sure that the medications that they are choosing are the best possible and the safest options for them.
I am a big believer in exercise for pain, and especially for arthritis, but probably for a lot of other things as well. So what do you see in your practice?
Yeah, so I would take a little bit of a different take on that sometimes. When we have knee OA or hip OA, we're going to have pain, and exercise isn't always about curing the pain or getting rid of the pain, but it's keeping people doing the things that they love. And so a big message sometimes is like, you can have pain, but you're safe. We say you're safe, but you're sore, right? And you don't always have to stop doing everything that you love. So exercise wants to facilitate that. So we can see pain reduce, but not always. And people can still have less suffering, even if they have pain though. So that's sort of one of the messages that we look at with physios, bring meaning to people's lives, keep them active. What do you want to do? Let's keep doing that.
Okay, we need to take a short break. When we come back, aging with pain, what's expected and what to look out for.